How did you get involved in this work?
And I've been doing some prevention work for the past 4 or 5 years. My entrance into it was through student affairs and working with peer educators, which then transitioned me into being focused on the health and well-being of our students and both public health work and prevention work.
Tell us about your coalition.
Our coalition's had a couple different forms. We've had always different committees on our campus that are working on alcohol and other drug prevention. Currently, right now, it is focused on behavioral health. We are the behavioral health advisory team on our campus.
What does implementing a strategy look like for your coalition?
In our data collection, when we had gotten some reports back, 80% of our students had perceived that alcohol was central to the social life of our campus. So that was a data piece that we really wanted to break into on a deeper level. And the way we hoped to do it was through norms and through normative correction, which is oftentimes something, a strategy that can be used. Specifically, we wanted to break into the beliefs. What are the underlying beliefs of our students on campus that lead to this perception? We wanted to analyze the beliefs that underlie these normative attitudes that we're doing it. We want to make alcohol less central to the social life of our campus, especially since we know that it causes a lot of harm. And so we delved into it through normative research. But we wanted to do in-person sessions. So we worked with our athletic teams. And specifically, we wanted to do some normative correction with groups in person. And part of the strategy behind this was to see if we could, in person, give teams a greater understanding of the norms in their community around alcohol, and then also see, can we also be correcting misperceptions that are also out there with athletes? So our specific strategy that we had used, we brought teams in together and we surveyed them. We asked them about 25 different questions around norms. And some of the questions might be like, how acceptable is it to drink the night before a game? How acceptable is it to drink every night of the weekend? Some different questions that play into it. And we asked it in 2 different ways. One way was, how acceptable do you think the majority of your teammates, the majority of your peers, find the following behavior like that? And then we also asked, how acceptable do you personally find the following behavior? And then what we'd do is after we asked them all the questions, we'd have them look at the data to see, how did it compare? How well did they know what their peers were actually thinking? And what we found is that oftentimes there was a misperception that was taking place with it. And then we discussed it with them. How did you determine what you thought your peers would think? How did you determine this personally for yourself? What does this mean for your team? What does it mean for how you come together as a community for this? So this was our strategy to do it, and we assessed it. We found that over nearly 70% of our students were saying they had a much better understanding of the norms on their team after participating in it. And we even had a quarter of our students that said they had entirely misperceived and overestimated the acceptability of alcohol use and binge drinking within their team. So we felt really, really good about these.
How do you think sharing this will help others?
I hope to actually just pass the knowledge of what has worked and a strategy that has worked in our community, and hopefully it can work with another community as well. I had learned about this strategy through another professional, Alicia Smith, who at the time was at the University of Dayton at a conference. And so we took it and we figured out how to apply it to our campus. And it's been very exciting for our campus to engage in the strategy, and we've seen some effectiveness with it. So I hope to do the exact same thing and be able to pass it off to another person so that way they could implement it in their community and hopefully make some positive impact with normative perceptions in their community.